a lot of people have stress right now that they don't know their COVID's risk status. So basically, like in places like Pakistan, they rush to the hospital. They don't know I'm coughing. I'm not sure. Go to the hospital and there's like thousands of people lined up. Only 10 tests are available. So there's a lot of cross-infection happening. And we have similar things in US, but maybe not that extent. So basically the end vision is kind of to have a cell phone app where basically you speak, you like cough into it, you breathe into it. It takes a facial video perhaps, it takes a video of your finger, and just kind of using the smartphone to pick up on the vital signs of the body, and then kind of feeding it all into like an AI algorithm to pick up like the micro vibrations in the micro variations in the audio, the things that humans can't hear, to pick up like, yeah, and give it like, okay, 90% chance you probably have COVID, your cough sounds like COVID patients or something. And then give them a recommendation so the healthcare providers can basically decide what to do next. Yeah, so then basically, I'll give you guys, I mean, that's the vision. And so we do have a website, we're still working on it. So like, we're collaborating with Japan, and because I'm an ambassador for Japan government. I mean, in Pakistan, we have government support as well, some universities. We like this has 100,000 users in Japan, this COVID dashboard, so we'll probably integrate with this daily 100,000 users. And then our website basically to gather, basically the main thing we need to do is to gather data. So right now we're going to start gathering data from hospitals like tomorrow. So under like the proper IRB approval, and they will basically you go here and you start recording. And basically the goal is that this web app will tell you what to do next. And yeah, and so what we're looking for is basically, let me open my notes. At this stage, our main thing is to gather data. We're working on deep learning. So if there's someone who's an expert in deep learning, maybe in the medical side, and could give us some mentoring, that would help, like audio analysis. Maybe a website developer could help as well, because our website's kind of not good. And grants, if we have someone to help us write grants, and maybe a faculty member in Stanford who could be our PI, maybe from infectious diseases or something. And yeah, and then the future direction, basically, we're hoping that this can expand to be something for even other diseases, like even the flu or future pandemics, that basically we get the system that people can use on their smartphones everywhere in the world. Yeah, so that's it.
Awesome, thank you so much. Then handing over to Casey, who will present her group's idea to democratize mental health care access.
Thanks for having me. I'm Casey. I'm working with Mika and Jamie and 2 other developers who we met through an external challenge. Our product is called Ray, and the idea behind it is that we want to create a free telecounseling platform to offer mental health care services to those who need it the most. The motivation for this is that we're seeing a huge surge in those experiencing anxiety and depression because of the effects of COVID-19. And a lot of the times, the people who are most negatively impacted are those who don't have the financial resources to access these services. So our current idea is to build an online platform and connect counselors to people who are seeking some care. So in terms of progress, we have our 2 developers working on building our platform. And at the same time, we're conducting a lot of user research, kind of as Alice mentioned. We want to make sure that we're understanding the needs. So far we are surveying just the Stanford population, but we're hoping to expand that once we get some more concrete data. Preliminary results have been very interesting and have been validating our hypothesis. Like over 60% of the Stanford students who've responded on our survey are dissatisfied with the university's mental health care services. So it kind of validates our hypothesis that there could be a space for a better service. In terms of our aim, we're trying to get our platform up and running at the end of April so that we can start pilot testing within the Stanford community before reaching out to broader communities. So in terms of needs. We are actively looking for funds and grants. We think that funding could greatly help us recruit someone to train and vet our provider side, so the counselors, to make sure they're at a certain level of quality. And we're also thinking that getting more publicity to get counselors to volunteer for our platform would be super helpful. So kind of as Josh mentioned, getting that media exposure would be really helpful for us as well. So yeah.
Great, thank you so much, Casey. And then handing over to Chino, who will present his website Hilferegister, which is also one stop user-friendly platform on mutual aid initiatives. So similar to what Andrew has created for Malaysia, this site is now for Germany. So Chino, over to you.
Yeah, thank you, Annika. I'll try to keep it rather short since we've gone over time already. Just going back about 3 weeks, I came back from skiing and actually caught corona myself, thankfully a very mild case. But during that time in quarantine at home, I was largely thinking about what I could do when I was, or after recovery and coming out of quarantine, largely with the hope of having immunity and, being able to help others who are particularly at risk. And so when I started researching what was out there, it was really, really tough to find, first of all, what's possible to do in the local area. What are all the things going on there? Not because there wasn't anything going on, but just because there was a flood of information that was completely disorganized. And so with the call that we had, the kickoff call actually for this initiative, is where I met Andrew, and we had a call right after to catch up and talk about how they set up in Malaysia. And that perfectly fit the issues that I'd been facing here and that I'd previously talked to a few friends about. So within a day of that happening, we already had a team of 5 people together and start working on it. I'm just going to share where we're at the moment. So what you'll see here is the current homepage. We launched this just over a week ago and started marketing it on social media in on Monday this week. Unfortunately, at the moment, everything's in German, so you probably can't understand too much, but I think main point is we've tried to keep it as simple as possible to make it possible to find help, and particularly to make it very localized based on postal codes, and then filtering either what kind of support you want to give, be it donations, blood donations, plasma donations, if you want to just volunteer, if you want to buy vouchers for local stores, this kind of thing, or also if you need support. But looking forward, so I think in Germany, we've got a active team that's now working on largely really getting people on the platform. We've been working on improvements based on user feedback for the past week, and are really trying to reach out to the press at the moment, and have had a little bit of coverage so far, which has already been really valuable. But in order to help as many people as possible, both Andrew and I have been talking together, how can we bring this into other countries, which will probably be hit much harder than we've been here. And so while our team here can definitely cover some local geographies that we have a lot of knowledge and a good network in, like Austria, we are looking for people who are willing to roll out a platform similar to this in other geographies. And Andrew and I have been working together to put together a sort of playbook, best practice from the experience. We have 2 platforms that have now been built. One, the Kita Jaga Kita, that's up and running in Malaysia, which is based on a rather simple code base, using an existing platform, and is simple to use. The one we have now in Germany that was programmed from scratch in order to give more customization and more features on localization. But both of those are also available for adoption in any new geographies. And we're really looking for anyone who's wanting to roll this out in their geographies. To make that rather concrete, this is something we've been drafting at the moment. What we're looking at, we've got this team at the bottom in dark blue, what essentially Andrew's team and my team together, some of the other people we have helping out through this initiative. are able to provide. And in the end, particularly for the local team, we need someone who then leads sourcing initiatives, filling the website with content, and then also having the network working on marketing and really making sure this gets out to people to help people. So anyone who's interested, feel free to reach out to either Andrew or myself. On the side, we're also looking for people on the tech side, so full stack developers to help us develop the platform further as well, and to make it more user-friendly and adaptable going forward.
Great. Thank you so much, Chino. And yeah, I think that's it from us today. And also, Alice, thank you again so much for taking the time today. It was really great. And yeah, just in case anyone, any remaining questions, otherwise, yeah, we're done for today.
Yeah, I just want to thank all these teams again. Such amazing work you guys are doing. Such amazing work. Yeah. It's really inspiring seeing, especially, you know, speaking personally, it's so inspiring seeing all the amazing things that you're doing. And I hope everyone here can take something away from this. So we'll remain on the call for a bit, and looking forward to seeing how you guys progress in the future. Thank you.